As you're scanning Wyatt, following along that arch so nicely with Itero, what are your thoughts on how much retraction you can see using the device?
It's much clearer with the ScanMate than it is with when I'm trying to retract with my finger. Your finger tends to get in the way and overlap with the teeth.
So here we are in Dr. Mazaka's office with Sarah, one of our assistants here, and she's using ScanMate on her patient with the Itero. And Sarah, why don't you talk about, as you're scanning the patient, what you feel as you're retracting some of those challenging areas, how it's benefiting you?
So this benefits me because it lets us see the tooth structure so much more, as well as the gingiva going through the teeth. This is a good spot to get distal to the molars, the terminal molars.
Because often there's that tissue.
It's that
issue,
tissue
right?
gets in the way, the cheek gets in the way.
Look at that beautiful scan.
For the model, a lot less chair time, not having to wait for the scanner to clean up all this. I mean, it looks so nice even just as it is right now.
Because normally, you were telling me earlier that often you'll have artifacts, whether it's
You have a lot
blood.
of tissue or even pieces of your fingertip around all this area trying to get the scan right. But using the ScanMate, you can see how clean it already is.
Yeah.
This is one of my favorite parts too, is using it for the bite scan. It just allows so much more for you to be able to see the patient's bite.
The bite drops in so fast.
Yeah.
Look at that. Wow.
Yeah.
Yeah, and if nothing else, I use it for that. Bite down.
Go ahead and bite down. Sometimes with a scan, you really have to scan the bite a few times in order for it to drop into place. And every time we use it, it just drops in so much easier.
Right.
Now with ScanMate, we have this new, this technique that we can use like this, as opposed to, say, like a lip pull, which
Right.
can be very uncomfortable.
And have that glove in the way
Yes.
that you don't want.
And then you get your picture of your fingers and everything.
Right.
Again, with Brianna's tiny little mouth, to get the distal of the last molar is very difficult. Without using the ScanMate, we would have to make several passes to try to get it, causing some discomfort for the patient and a much longer scanning time.
Okay, that scan's just coming in beautifully.
Yes. When you come around to the lingual, you frequently will get the lip in your scan. But with the ScanMate, you have no lip at all in the scan. You don't have to worry about your angle. You can focus on getting between the teeth and all the pieces that you need and not worry about the lip dropping into the picture. Again, see how beautiful the 12-year molar? No problem in her tiny little mouth with the ScanMate. I rest the tip on the ScanMate and I let the ScanMate almost guide me to where I want to go. And then I'm getting that full retraction. And not just from, if you get the retraction from just the scanner, that's when you get the lip in the picture. But with the ScanMate, there's no lip.
Yeah.
And bite down all the way. Again, I'm resting this on here. I can get full retraction to the molar. So see how quickly the scan drops in? So quickly. I had a patient the other day, bite down, that was having the worst time with their tongue, and just a few minutes with the ScanMate, and I was able to get the scan quickly.
Really?
Yeah, so much more comfortable, especially in that back molar area.
Did you film the cleanup time on that
I
one?
did.
Because did you see how fast that one went?
Yeah.
Normally, how long on average is cleanup time? Just
About a minute.
Yeah, a minute, 90 seconds.
Yeah.
And that was about
To a minute
5
and a half.
seconds.
And that was about 5 seconds.
And we're in Rocco's office in Hanover, Mass, and his amazing team has allowed us to come in. They've been using ScanMate, and they're going to give us our feedback on that. So go for it, guys.
I'll start. Using ScanMate just seems to make the process for the patient that much easier in terms of comfort during the scanning process, in terms of quickness. It allows a less chair time for each patient. Yeah, we've had positive feedback from it.
Great, thanks, Sarah. Brianna?
Also, so I was just in previous videos scanned before, and I feel like it was much more comfortable, especially towards the back molar part of your mouth, second molars, especially. I have a really tiny mouth, and it seems to be much more comfortable. The scanner just seems to glide through much more comfortably. Also, we noticed that a lot of like your glove and materials can get picked up throughout the scans, and it just seems like the cleanup time for the scans is much more time efficient.
Yeah. Not only with today, but with previous patients that I have scanned, I've noticed that it's made the process quicker and more enjoyable for them because they are not being scanned for as long. They are also, I'm not telling them to move or move their tongue or do this or do that. I'm able to take care of all of that for them. So when I'm scanning, I can just get the pictures done that I need, get the work done that I need, and they can get out of the chair quicker.
Thank you so much. Really appreciate it.
Thank you.
Thank you.